Hi everyone, my name is Gina and I did my presentation on therapy dogs in the emergency department specifically. Okay, so I reviewed 5 studies. The focus was patients in the emergency department in some kind of pain or discomfort, as well as patients experiencing anxiety. And secondary to that, we looked at institutionalized elderly and healthcare professionals regarding depression and anxiety and nurse burnout, as well as compassion fatigue. And then also just how the general population in the hospital, whether it was family members, friends, the patients, or the staff, how they felt and their opinion about the therapy dogs being in the hospital setting. So depression and anxiety are very common in institutionalized elderly. And patients that are coming into the emergency department usually are in some kind of pain or discomfort. And there's also a lot of waiting times, and they are anxious and uncomfortable, and the wait just increases their anxiety and they're stressed out. So that is kind of poorly managed, and then they get into, see somebody and they just give them drugs. And I'll talk about that in a second. Nurses, as we know, are experiencing burnout and compassion fatigue, and that in turn affects their quality of patient care that they're giving because they're not 100% or even 80% because they're just so overworked and exhausted. Physician and nurse burnout is actually the highest in the emergency department specifically, so they need some help. Okay, so the problem, like I was saying, was that the go-to is just drugs. And I get that. If you're understaffed and you're burnt out, you can't stand there singing to the patient and doing all this distractions and all this. It's just not realistic. So we give drugs. And that's not really the best method for the patient's overall wellness. You always want to try non-pharmacological measures first. And so therapy dogs with a handler that are trained, of course, and, whatever precautions need to be taken for the handler, PPE, etc., can be worked out, but this isn't something that the nurse has to run around doing. This isn't an extra thing for the nurse. The nurse isn't the one bringing the dog in and handling the dog, so it's a non-pharmacological way to help patients decrease their anxiety and even help alleviate some of their pain through distraction that the nurse doesn't have to do. So the question was, do therapy dogs help lower patients' anxiety and pain in the emergency department? So population, patients in the ED, intervention, the therapy dog, the comparison to patients that did not get a therapy dog intervention. The outcome is that we are going to see decreases in anxiety and pain in these patients. And we're looking at pre and post intervention. So whatever time was spent with the emergency dog, the therapy dog. Okay, so my search strategy, I used PubMed, NIH, and Google Scholar to find articles as like my search engines. And then I looked at primary research, controls, trials. And then if I found something really good, I would click on similar articles and look through those. And also used my keywords as a guide. My keywords include things like therapy dogs, hospital settings, emergency department, anxiety, pain, support animals, canine therapy, etc. And I used filters like putting only articles in the last 5 years and peer-reviewed articles. So The findings showed that dog-assisted therapy is a great intervention. It showed clinically significant decreases in pain and anxiety with emergency department patients, and significant decreases in anxiety and depression in the like elderly homes. It's great with older people, children, everybody, middle-aged people. It also institutionalized elderly. That's the word I was looking for. It decreased depression in institutionalized elderly. And the 5-minute interaction with nurses and providers, just emergency care staff in general, significantly reduced their stress levels and allowed them to give better quality of care and have more sympathetic responses to patients. And the acceptance by the patients and the staff and family members and friends that were there that took that survey about their opinion of therapy dogs in the hospital were super good. Everybody almost was accepting of the therapy dogs. So great results. Evidence. So compared with usual care, the anxious patients got 15 minutes of exposure with a therapy dog, and it showed a 35% decrease in anxiety, as well as significant decreases in pain and depression. They weren't just decreased for like a second, though. They were sustained. So it lasted for a while, even after the dog had left. 2.5% of patients still needed opioids for the remainder of their stay, but usually it's about 17.5% of people who request opioids in that same time period. So that's way less. As well as we have evidence of the nurses and providers by their cortisol in their spit. It was decreased, which shows decrease in stress levels just with that 5-minute interaction they had on break. And then that survey that we gave out that showed that people were supportive and liked this idea. It was about 93% of patients and 95% of staff loved this. Okay, so the answer to the question is yes, therapy dogs are awesome. They help decrease anxiety and pain and depression and even nurse burnout, provider burnout. And I didn't put this in the presentation really, but even family members of the patients were happy with seeing the dog around and the benefit that their loved one had, by having that intervention experience. So, moving forward, these findings contribute greatly to this subject of involving therapy animals in the healthcare setting. The potential benefits that need to be further explored, and this is still not very vastly studied. There needs to be larger population sizes tested in different settings. A lot of policy changes are going to need to be looked at. It would definitely take a while to implement. We're not that close to really implementing animals in the emergency department, but there's enough research to really drive a need for more studies like this because it really can be very beneficial. And it was said in one of the studies, and I quote, "The rationale for therapy dogs is supported by prior literature that demonstrates that the human perception of stress and pain can be reduced with exposure to animals." So this isn't a new thing. I used to volunteer when I was younger with my grandmother at a children's hospital for children with cancer. And they actually did use therapy dogs. And we would bring the dog into the room and I would see the kids' faces, and it was awesome. And it had such a great impact on them. So I don't really understand why we don't see them more often, or what's exactly holding back moving forward with this. But hopefully we start seeing therapy dogs in the emergency room in the future. Thank you for listening. And these are my resources, my references.